Hello Namaskar and welcome back to my channel Physio Trends, and this video I am making for the Physio Quest series and for the questions asked during this week. Question number 16 and 17. The interesting fact is both the questions answers were A this week. Let's see how it was A and what are the reasoning behind the answer. So guys, first question which I have asked during this week, it says the information what you have received is while gait training a patient recovering from CVA, cerebrovascular accident, the therapist observed the knee on the affected side going into recurvatum. So during stance phase, the most likely cause of deviation can be what? Now we have seen this genu recurvatum question last week also. In that also I told you that sometimes because if you have anterior pelvic tilt or if you have plantar flexion in the ankle, it can cause the problem of genu recurvatum, and that is again relevant here also. How? I am going to tell you now. The option A what we have got is weakness or severe spasticity of the quadriceps. Okay. Option B is weakness of the calf and spasticity of the pretibial muscle. Now here it is relevant. How? Because see, I told you that more of plantar flexion can cause genu recurvatum. Now here we are talking about calf muscles are weak, so plantar flexion obviously is not going to be there, so that is not going to cause genu recurvatum. So that is why option B eliminated. Option C, weakness of both calf and pretibial muscle. Again, weakness of calf means it is not going to cause plantar flexion, no recurvatum. So that option also removed. Option D, severe spasticity of hamstring or weakness of calf. Again, weakness of calf has come. I am eliminating this option as well. Remaining option is option A, which is weakness or severe spasticity of the quadricep muscle. Now here we need to understand what will happen if there is spasticity of quadricep. Quadriceps are attached on the anterior part of the femur and the tibia. Basically quadricep tendon comes and attaches on the tibial tuberosity, right? So which is going to pull the tibia in the anterior direction, which is exactly what happens in the genu recurvatum. So if spasticity of quadricep muscle is present, it can cause genu recurvatum. Now the question comes, how come weakness of quadricep can cause? So again, weakness of quadriceps, because of that there will be compensatory mechanism like how we see in hand to knee gait. In hand to knee gait we obviously observe that because of quadricep muscle weakness, patient tends in stance phase to perform the hyperextension of the knee with the help of hand. So here I am not saying that patient is performing the action with the help of hand, but because of the weakness of quadricep muscle, it can cause the hyperextension in the knee joint, and which is what we call it as genu recurvatum, and that is why the correct answer for the question is option A, which is either spasticity or weakness of the quadricep muscle. So I hope you have understood this answer very well, and if you still have any doubts, you know what to do, just comment below. Moving forward to the next question asked in this week was question number 17, which says that patient diagnosed with left lateral epicondylitis has no resolution of symptoms after 2 weeks. So 2 weeks treatment has been given, but still there is no pain relief. So therapist begins re-examination and finds the left biceps reflex is 1+, and the complete examination, the therapist should do what next for the completion of the examination, and options are given, which is option A is mid cervical region examinations, option B is cervicothoracic region, option C is upper cervical region, and option D is cervicocranial region. Now here the question comes that okay, so first of all we found out that patient has lateral epicondylitis. We were treating for the same condition to the patient. That time maybe we forgot that if patient has any weakness, patient has any reflex issues in the upper limb or not. So we treated the patient, and till 2 weeks there was no response from the patient. Obviously if it is an inflammatory condition, no response, then we have to re-examine the patient, and that is why patient has started re-examining the patient thinking that there can be involvement of cervical segment, and that is why the biceps reflex was checked. Now we need to know that bicep reflex is affected whenever the C5 nerve root is affected. So here one thing is clear, C5 is affected. Okay, second thing is we also should know the grades of deep tendon reflexes. Here it is given 1 plus. 1 plus means it is diminished reflex, 0 means no reflex, 2 plus means normal reflex, 3 plus means exaggerated reflex, and 4 plus means colonus reflex. So here information given is 1 plus, which means that it is a diminished reflex, which means there is some nerve root compression at the C5 level, and because of which patient might have the problem of lateral epicondylitis as well as might develop some weakness in the bicep muscle, which are supplied by the C5 nerve root. Now, okay, not going in more detail about the C5 nerve root, let's check the options what we have got. Option A is mid cervical region, yes, which involves your C5 vertebra. Then cervicothoracic region. Now this involves your C5 maybe, but also involves your thoracic vertebra. So I am going to eliminate this option. Option C is upper cervical region, which does not involve C5. So that is why I am going to eliminate that option. Cervicocranial region. Again, that is also upper part of the cervical vertebra. So that is why this option also eliminated. The only option which is left is option A, which is mid cervical region, will be your correct answer. So guys, this is how we just solve these questions on the PhysioQuest series, and I hope you all are enjoying this series. But please let me know in the comment section if any suggestions are there, or if any confusions are there, if something I can improve in the series. Please do let me know. I will see you all next week again with more questions and more answers and more explanation.